So let's discuss how tachyarrhythmias, or rhythms with extremely high heart rates, can affect the hemodynamics of the body. We're going to discuss the physiological effects on the heart caused by increased heart rate. We're going to describe how increased heart rate can cause relative ischemia due to increased muscle demand. Explain how the heart rate can have negative effects on ventricular filling times and end-diastolic volume. And discuss the hemodynamic domino effect in relation to increased heart rate on hemodynamic stability. So rapid rates affect the hemodynamic status of the heart by causing relative ischemia, decreased ventricular filling times, and decreasing end-diastolic volume, and decreasing atrial kick and ventricular overfilling, which is required for the Frank-Starling mechanism to come into effect. So faster rates cause faster muscle activity, and faster muscle activity requires more oxygen. If a person cannot meet the demand, he or she develops relative ischemia. An imbalance in the supply and demand of the oxygen to an area results in relative ischemia, and is only during periods of increased demand. Ischemic muscle becomes stunned and doesn't function as well, which also leads to hemodynamic consequences, and it decreases the ejection fraction of the heart. Ischemic muscle does not contract appropriately, which leads to a decrease in the ejection fraction, the amount of blood pumped from the heart with each contraction. It is the ejection fraction that expands the aorta. Therefore, if the amount of blood ejected is lower, the aorta will not distend as much and the pressure exerted by the aorta will be lessened. Less aortic pressure equals less perfusion throughout the body tissues and leads to a shock state. Rapid rates affect both systole and diastole, but diastole is shortened much more. Faster rates shorten the rapid filling phase and less blood ejected to the ventricles during atrial contraction. Both systole and diastole are affected, and since ventricular filling occurs during diastole, the amount of blood that actually enters the ventricles is greatly decreased. Hemodynamic stability is strongly related to the rate of the tachycardia. At the slower end of the SVT spectrum, the amount of blood that fills the ventricles during ventricular diastole is greater than at faster rates, since there is more time for the blood to enter the ventricles. This figure illustrates the hemodynamic domino effect of tachycardia. The faster the rate, the shorter the period for diastole. The shorter the period of diastole, the lower the ventricular filling time. The lower the ventricular filling, the lower the stroke volume. Stroke volume is also referred to as ejection fraction. The lower the stroke volume, the lower the blood pressure. And when you have this domino effect occur, then that patient will become hemodynamically unstable. So many tachycardias cause inadequate atrial mechanical contractions, which leads to decreasing atrial kick and decreased ventricular overfilling. Many tachycardias have no atrial activity whatsoever. SVTs are usually well tolerated in the short run unless the rates are very, very fast. The ventricles contract in a synchronized fashion. The atrial kick is often maintained. The hemodynamic stability present in many of the SVTs allows us to spend a few extra seconds or minutes correctly identifying the rhythm involved.